All right, so today we're gonna do medical assessment. Jimmy here is gonna be my patient to assess. To kind of prep you the scenario for this, Jimmy is gonna be demonstrating a patient that's having chest pain, and I'm gonna be assessing him for his complaint. Just gonna be going through the medical assessment forms that the state of Michigan uses for this. Just kind of go step by step through it to show you kind of what a consistent, smooth flowing assessment looks like. Again, not real life type thing. This is just going off of the flow sheet that we have to evaluate you on, especially at the EMT level for Michigan. So just starting from top to bottom, and I hope we get every point in this. So BSI, my scene is safe. I know I'm dispatched to chest pain, male in his 20s, complaining of having chest pain. That's all I know. So I got my BSI on. I'm looking at my patient. He's sitting there. I'm looking at the environment. I don't see any dangers, so my scene is safe. I'm going to ask the proctor, is my scene is safe, yes or no? And they're going to say yes. So as I'm coming up to him, I'm looking at him. I don't see any mechanism of injury, not trauma suspicion, so I'm kind of dealing with NOI, nature of illness, as I'm walking up to him. I'm seeing a male in his 20s. My general impression of him as I'm just looking at him from afar is he's hurting a little bit, clenching his chest, showing that he's got some discomfort. However, at this point, if I'm an EMT, I'm gonna be calling for an ALS truck for higher level of care because this is chest pain. I know this is gonna exceed my care as an EMT, and he's my one patient that I can see. I don't see any other patients laying around. Ask the proctor that, make sure that I'm not missing any, and I don't see a need for cervical spine for this patient at this current point because I'm dealing with mechanism of injury. So already did my general impression. I'm seeing him having chest pain. I'm gonna do my quick AVPU scale on him. Hello, sir. My name's Doug. What's your name?
My name's Jimmy.
What's your chief complaint? What's your main complaint today?
Oh, my chest just hurts.
Chest just hurts. Okay, so I got chief complaint of chest pain. He's an A on the AVPU scale. He's got an open airway because he's talking to me. He's breathing adequately from what I can see. I don't see any laborious respirations. However, still could be breathing labored again for the simulation. Hard to show. So airway's open. Breathing adequately. He's got pink warm dry skin as I can see on him from my circulation. Okay, so I'm just gonna feel a pulse here real quick just to kind of see what your heart's telling me. He's got a good strong radial pulse, and I don't see any obvious signs of bleeding. So right now, I would categorize this as a priority 2. I don't need to load and go right now because I'm gonna dive into more what the issue is for my patient. So ABCs are covered. Now I'm gonna kind of dive into my history taking. All right, sir, so I'm gonna start off with asking some questions about your chest pain. I'm gonna go through OPQRST first because he told me he's having chest pain. So when did this all start?
This started about 20 minutes ago.
Okay, what were you doing when this started?
I was just sitting watching TV.
Okay, does anything make it go away?
No.
Okay, so I got my onset, my provoke, and palliate. So what makes it worse? What makes it better? Q. So quality. So what does it feel like? What does your chest
It's like it's pressure.
Okay. Does it go anywhere else in your body?
It's going into my neck a little bit.
Okay, so I have my quality. It's a pressure. It's radiating into his neck. Describe on a pain scale of 0 to 10. 0 being no pain, 10 being the worst pain you've ever had. What would you rate your chest pain?
I'd say it's like an 8.
An 8 out of 10? Okay. So now I have my severity, and I already have time, and he said 20 minutes ago. And what were you doing again, sir, when this all started?
I was just sitting watching TV.
Okay, just sitting watching TV. So that's the true onset, and I have the time. Remember, don't get onset and time mixed up for that. So again, priority 2 right now, I got some time to work with. So I'm gonna dive into my sample history as maybe my partner's getting vital signs. One-man show right now, so I can't do anything else. So he's telling me he's having chest pain. He's kind of clenching his chest, so he told me his signs and symptoms already. Any allergies, sir, that you're aware of?
Penicillin.
Penicillin, okay, any others?
No.
Environmental allergies, not just medications, okay. Medications you take in general?
I take metformin.
Metformin, okay. So history diabetes. So past medical history for P. Diabetes, is there anything else that you're diagnosed with or that doctor says you take medications for or that any of the medical issues that you know about?
No.
No? Okay. So I got my P taken care of. L, so last oral intake, sir, when was the last time you ate or drank anything?
About 45 minutes ago.
5 minutes? Okay, good. And E already have events. He was sitting down watching TV. Sample history done. OPQRST established. So now I'm really going to focus in on his chest here because he's having chest pain. He's not having any other signs and symptoms yet that's kind of misleading me. So now, sir, I'm gonna get a set of vital signs. Just gonna take a blood pressure here real quick, just to see what your heart's telling me. While we're getting our stretcher set up, I'm gonna want to get that stretcher as close as possible, and with a cardiac patient, I don't want to have him walk anywhere. So, just gonna put it on him real quick. Alright, so just take blood pressure. Sorry, my hands are cold. Means I got a warm heart. Got a real pressure of 128/76. Turn to my proctor and ask, is that what I got? Or if they're gonna give me a different number. Whatever, they're gonna throw a number at you for the blood pressure. Get a pulse ox real quick. Turn that on, see what he's getting there. So I got my blood pressure. I can count my respirations while this is acquiring. Just gonna watch his chest for 15 seconds. I'm gonna say he's 24 times a minute for breathing while that's acquiring. 100% pulse ox, heart rate of climbing into, and we're in the 60s right now. Verify with the proctor, is that what I actually have for vital signs? If not, they're gonna tell me what the sheet actually has for vital signs. And at this point, I'm gonna wanna give my patient some aspirin while I'm waiting for the stretcher to be brought up or stair chair. I'm gonna give him 4 baby aspirin for a total of 324 milligrams. I'm gonna get my aspirin out. Here you go, sir, here's 4 baby aspirin. Can you please chew those up for your chest pain? As I have the equipment, we're gonna transfer onto a stair chair, get him out of the house, onto the stretcher. Again, we're gonna help him transfer onto the stretcher. We're not gonna make him walk. Now we're in the ambulance. Like I said, still priority 2, having chest pain. And now I'm gonna start considering giving nitro to my patient for his chest pain. Depending on his blood pressure reading, let's say he has 180/100, we can give nitro for his chest pain. So I'm gonna be, sir, so I'm gonna give you nitro now. Is your chest pain still an 8 out of 10?
Yeah.
Yeah? Okay. So I'm gonna give you nitro. Let this dissolve underneath your tongue. And let me know how you feel in a couple minutes. You're probably gonna get a headache, dizziness. That's normal side effect for the nitro. Bounce down the road. As he takes nitro, I'm gonna make sure I recheck his blood pressure every 3 to 5 minutes, because that's important, because I need to watch for any trending vital signs downward for his blood pressure, or if it stays there, I'm gonna keep reevaluating his pain level, make sure it is going away. And let's say that we intercepted with ALS. I'm gonna tell my ALS partner, this is Jimmy, he's having chest pain. We're approaching probably about, I'll just say 40 minutes total time frame. 8 out of 10, was watching TV when it started. Left-sided chest pain, radiated into his neck, no prior cardiac history for this. Is it diabetic history? No new medications. Last 8, I think you said earlier today, if I remember correctly. Obviously, and you can write this stuff down as you're going through the scenario. And just do that handoff report to the medic. And then just have ongoing reassessment, or once that happens, then the medic will take over. So that's basically everything in a nutshell for medical assessment.